of Columbia have more in common with the communities and our members than ever. And of course, recent events that people wouldn't have thought possible in the United States, troops coming in to occupy our city, federal violence against peaceful protesters, the threat of canceling elections in what we all understood to be a democratic society, have been all shockingly making the point all too aggressively. I want to thank, of course, Dr. El-Bayoumi, who is obviously not just a brilliant physician, but a wonderful friend. Literally the woman who I trust with my very life, is my longtime personal physician. And I think that we have responded as best we can in the District of Columbia. But the example of Taiwan and the World Health Organization is a dramatic parallel. First of all, let me thank the Republic of China and Taiwan, because they have donated so much of the necessary PPE and personal protective equipment that we've been using here in DC. We have problems getting our mayor on these calls with the governors, and that has only hurt us. The lack of equal funding, all of the things that were talked about make clear why we belong in the UNPO, and that's a shame, because we should be a represented people. We should have all of the rights. So this has been really a great day, a great meeting. One, it was great to welcome fellow American unrepresented folks as Guam joined, and it was great to have such an informative presentation. So thank you, Dr. El-Bayoumi. Dr. El-Bayoumi, like Dr. Anthony Fauci, lacks equality in our government. So the very physicians who were trusting to help us out of this pandemic aren't represented in our government because they live in the District of Columbia. And so we look forward to working to change all of those inequities and to balance that.
Thank you very much, Senator. Let's move to now. The next speaker is Zidan Lafdal. Zidan, are you here?
Speaking, but there's no
yeah, Zidan
voice.
is the next one. We will follow the list now. I have him here, and then I will.
Got a grant due at 5 o'clock. You want to have what? A grant due at 5? Oh, no. Oh, that's
Zidan,
okay.
we can hear you.
Enter your participant name, followed by the pound or hash sign.
Yes, please go ahead. The floor is yours, Zidan. Zidan, hold on. Sorry, we cannot hear you. Zidan? Sorry, we cannot hear you. Let's try again. Otherwise, Zidan, if you can hear us, raise your hand, please. But we cannot hear you. Sorry. Let me just check if my colleagues, Nasser, can you hear him? No. Let's move on to the next speaker, and in the meantime, I'll try to fix the connection with Zidan. According to the list, our next intervention is from Mukwe, from Balochistan. Mukwe, you are here. Right to the right. Here. Mukwe, if you can hear, please accept my invitation to speak, and the floor is yours. And in the meantime, I'm trying to fix Zidane's connection. It doesn't seem she's accepting, so let's go to the third one, which should be Abdi from the Ogaden.
Hello, do you hear me?
Abdi. Yes, please, the floor is yours. In the meantime, yes.
Is my video coming through?
Yes, the video and the audio it's perfect. It's good to see you, by the way.
Good to see
hello. Thank you very much, Fernando, Lucia, Nasser, Dr. Edna, and many others I don't know, and Secretary General Ralph. Is he around?
Yes, everybody's around. Well, yes.
I've for the last 2 years I was so busy in the transition in the Somali state in Ethiopia, and I missed a lot from the UNPO. And
you're welcome back.
It's a pleasure for me to see Dr. Edna, who has been a significant force in the Somali women's movement, especially what she did in Somaliland. For the last 20 years, she has been a big force. Actually, many of our women who have been raped here were taken to our hospital. We thank you very much for all the good things you have done, Dr. Edna. And I have listened to your speech, and you touched my heart very much. I fully support you and your effort to have a prosperous, free, independent Somaliland, inshallah. And then later, maybe we could all come together in a better relationship than what happened in the last 30 years. Apart from that, we in the Ogaden, or what was used to call Western Somalia or Ethiopian Somali state, have gone through a bit of transition. For the last 2 years, we reached an agreement with the Ethiopian government, and we have been ever since trying to rebuild the lives of the Somali people in this area, which affects all the region, from Eritrea to Kenya. As you know, at the advent of this coronavirus, and as is usual in all parts of the world, what we observe everywhere is that at the political level, governments actually think it's a God-sent relief from all the democratic transitions happening around the world, and many of them immediately, promulgated new laws that restrict, democratic rights. They narrowed political space for political opposition or marginalized groups, and they've got a chance to postpone all the elections. So on the political level, it has affected many marginalized people. On the other level, for example, at the economic level, for example, Somalis across the Horn of Africa have been, because of the great war that happened around the Horn of Africa, whether in Somalia, in the Ogaden or other parts, many Somalis displaced from their homes. They went to the diaspora, and ever since we had big refugee, communities who were surviving on the remittance from, the diaspora countries, especially the Western countries, and that has been grossly affected. So it has affected the livelihood of Somali people, whether in Somaliland, Somalia, or maybe Kenya, or even Djibouti, or the Ogaden. That has been a very, very direct economic effect. The coronavirus has on the marginalized groups, especially people who don't have any ability to sustain themselves. On the other side, on the public health system in Africa and many other communities all over the world, they don't have all the trappings of the developed countries, and the coronavirus has affected them very, very much, because they don't have what they call these ventilators. They cannot get away from the economic needs of waking up every morning and going to the market to earn their living on a daily basis. So they have a lot of issues that are affecting them economically, socially, politically. So coronavirus has affected more than marginalized groups, more than any other people of the world. And on the other hand, there's no safetiness in the developing countries, where, for example, the developed countries, maybe they could have this relief from the government, so they can stay at home. So, for example, in Somalia area, everyone has to wake up in the morning, or even other parts of Ethiopia, we see that. So that is making them more vulnerable to the effect of coronavirus. But the most, effect is on the narrowing of the political space. We see everywhere across, the third world countries, for the governments that they can promulgate laws, they can postpone elections, they can impose these restrictive laws, they can conduct their political activities while restricting the political activities of the opposition parties and marginalized groups. So we believe, it has affected adversely marginalized communities, people who have already been oppressed, who have been, their rights have been, limited. These, de facto states which has no rights in the international system. So we believe, coronavirus is a godsend, sent to all those countries that will have liked to keep their people under their feet. And I will just stop short there. And what I will also, I just take this opportunity. I've been away for quite a while from the UNPO activities in the Somali region. Now we have established peace, but peace in quotes. Still, there's a lot of challenges. There's transition challenges. Political, from fighting force to a political opposition force is a big jump, and we're having a lot of transition traumas, economically, socially, politically. At the same time, we are coping. We are, at least the Somali area in Ethiopia is the most peaceful area where what's happening in other parts has not affected us. Both the regional state and the ONF are coping on that. And we're also across the border with our Somali brothers all over the country, either Somaliland, Somalia proper or Djibouti. We're also creating good relationships, and we hope that will continue. And we are very sorry about what's happening in the other parts of Ethiopia. And we will hope, they will sort out their problems. Thank you very much. I don't have much to say, but I'm very happy to see all the people I knew here, and I'm very happy to see the face of Edna. Thank you very much.
Thank you very much, Abdi. Thank you so much. I am trying to get Zidan back. Zidan, if you can hear me, I invited you to interact live again, but you don't seem to be getting my message. We'll keep trying. The same goes to Mukwe, if she can hear me. This is your chance. But not, do I have some? Okay. The next person on the list, I have Barbara from Catalonia. Is Barbara here? Yes. Barbara, yeah.
Hello.
Hello, could you please introduce yourself? Yes, and
thank you, Fernando.
My pleasure.
Thank you to all of you. Good afternoon from Catalonia. My name is Barbara Rovira. I am a member of the Catalan National Assembly General Board. First of all, thank you very much and congratulations to UNPO and its members for the organization of this General Assembly in such difficult circumstances that we are all facing due to the global pandemic. The management of the COVID-19 crisis by Spanish authorities has had a negative impact on the rights of the Catalan minority. In March 14, 2020, the Spanish government led by Pedro Sánchez declared the state of alarm, a provision included in the Spanish constitution, which was extended 6 times with the varying support of the opposition. By the Royal Decree 463/2020 of the state of alarm, the Spanish government effectively centralized the management of the health system and emergency supply lines, as well as regional interior affairs, which otherwise were the responsibility of autonomous communities. This created more confusion as it clashed with regional governments who were kept out of the decision-making process, to the point where the Spanish government refused to reveal the names of the team of experts in charge of designing the de-escalation schemes for each community. The centralization of the supply lines of much-needed medical material by Spanish authorities also caused delays in their delivery to hospitals in territories such as Catalonia, which had harmful consequences. During the state of alarm, the Spanish law enforcement forces made extensive use of their organic law of citizen security protection, infamously known as gag law. By May 20th, the combined law enforcement forces had dispatched over 1 million fines and arrested over 8.400 citizens, surpassing the accumulated number of fines in the previous 4 years. In a different vein, following the recommendations of international bodies such as the UN, WHO, the Council of Europe, and NGOs such as Amnesty International or Human Rights Watch, countries around the world have released thousands of prisoners in order to stop the spread of the COVID-19 in prisons, including those who have been arbitrarily detained. Instead of observing the example of European neighbors, such as the Netherlands, France, and Germany, Spain did choose to keep Catalan political prisoners in jail. Moreover, the Spanish government only emitted information in Spanish, ignoring the OSCE High Commissioner on National Minorities' recommendations on short-term responses to COVID-19. Catalan, Galician, and Basque have not been used in official statewide communications. In contrast, a European country like Finland has provided COVID-19 information in Russian, Somali, Arabic, and English. Considering the effectivity and proportionality of security measures in the aftermath of the first wave of COVID-19, the double standards by police officers exemplified before show an extremely zealous behavior towards migrants and members of minorities, yet a certain leniency concerning aspects of Spanish nationalism and far-right groups. Furthermore, the lack of transparency and democratic guarantees during the COVID-19 state of alarm, as well as the attacks against freedom of expression and freedom of assembly via the Organic Law 4/2015, is a reason of concern. The rights of freedom of expression, freedom of association, freedom of assembly, freedom of the press, and political participation have been and continue to be violated by Spain, especially against minorities, but the situation has worsened with the spreading and confinement of COVID-19. Thank you very much.
Thank you very much, Barbara. Thank you for sharing. Let's try once again, Zidane. Zidane, you are on the screen. Please say something.
Hi, everybody.
Yes, we can hear finally.
Now?
Yes, we can. Please go ahead.
Thank you. Hi, everybody. Hi, General Secretary of UNPO. Hi, all UNPO staff, Fernando, Lucia, and Michi, and all the UNPO members. So we, Kabylia, by the way, my name is Zidan Abdal, so from Kabylia, from Self-Determination Movement of Kabylia, and Provisional Government of Kabylia as well. So I will start by welcoming our warmest, the greatest welcome to the new members, Catalonia, Guam, Zambezia, Yoruba, and Biafra. We have same concerns, same interests, same fights. Hopefully, in the near future, we will support each other to achieve our goals and objectives. As you know, the people here, we are raising some severe concerns. Algerian regime persecution of Kabyle people is not new. Of course, the Algerian nature is to persecute Kabyle people since 1962, the year of the supposed independence of Algeria. We have a famous quote in Kabylia. We say French colonization is replaced by the Algerian colonialism. In the recent years and months, the Kabyle fighting for the independence is in an exponential growth. A large majority of Kabyle people is now convinced by the self-determination and even independence of Kabylia. On the other hand, so Algeria wants to stop that expansion, that exponential growth, by all the means, by the police, by the army persecutions, by terrorism in Kabylia and in all the Kabylia lands and territory, by involving also courts and judicial authorities. So which is what we call newly the judicial terrorism, inventing criminal facts and cases and involve the Kabyle activists to imprison them and jail them. They even elaborated, so the Algerian regime elaborated laws to make criminal all the fights for identity, for cultural, for human rights, for self-determination rights. Now, the regime is currently in the summer is lighting up criminal forest fires in all of Kabylian forests, with letting the Kabylian people with no assistance to extinguish these fires or to prevent them at least. So they aim to kill Kabylia socially, economically, culturally, and all the aspects of life. Furthermore, so during the pandemic COVID-19 crisis, Kabylia found herself alone with no assistance from the Algerian regime. Even worse, so the Algerian regime deployed all the possible means to worsen the situation by contaminating even the Kabyle people, creating situation so that Kabyle people will be contaminated. Kabylia set up its own auto-organization to face this crisis alone by kicking out the Algerian authority, the Self-Determination Movement, MAC, and the Kabylia Provisional Government, and Azarouj, so our humanitarian NGO, provided full support to Kabylia, distributed all the protection means, mask, hydroalcoholic solutions for all the hospitals, medical centers, public offices, shops, and people who need urgent needs, so weak people or sick people. We will address here, we take this opportunity to address the United Nations, Worldwide Health Organization, all human rights organizations to lead an investigation on how Algeria managed in a criminal way the COVID-19 pandemic crisis. Beyond that, the Algerian regime threatens the Kabylian activists for independence to assassinate them, some of them, to assassinate some of Kabylian activists fighting for their independence. And also there is a new movement called Rachad. Rachad is based in London and Geneva. So they declared a war recently by taking arms and weapons against Kabylia in general and the independence activists in particular. Another thing is important to know that during the recent presidential election, Kabylia didn't vote at all. So 0% votes, whereas the rest of Algeria elected the current president. So Kabylia now don't recognize the current Algerian government, and even more rejects all the Algerian authority in the Kabylia territory. At the end, I take this opportunity to launch an SOS, an urgent rescue towards UNPO and all the members to support Kabyle people and Kabylia in her self-determination right and recognition. And also I renew the call to the United Nations, to the Worldwide Health Organization to lead an investigation against how Algerian regime, they managed in a criminal way this crisis, pandemic COVID-19. Thank you very much.
Thank you very much, Zidane. Thank you. Appreciate it. Moving next to our representative from Balochistan, Mukwe. And she is live.
Yes. Good morning. Can you hear me?
Yes, we can see and hear you. Good to see you.
Fantastic. Fantastic. Sabah al khair. Bonjour. ¿Cómo estás? Todo gentes at UNPO. Good morning, good afternoon, and good evening. Wow, this has been amazing. And I'm just encouraged by all of the words that many of the new members and old members have spoken related to our common histories, our common goals. And I'm hoping that the sessions between now and the end of the conference will be able to make up our minds in terms of the way forward, in terms of UNPO superseding the United Nations, which is a completely compromised space. So I just wanted to share the message from Barotseland. I'm Mukwawa Basiolwe, and I am the chairwoman general of the Barotse National Freedom Alliance, whose mission is to actualize the BNC resolutions, Barotse National Council resolutions, to walk away from the Republic of Zambia after it abrogated our treaty with the British called the Barotseland Agreement of 1964. So I'm just going to read this for now. This is our response to the COVID challenges from the people of Barotseland. Since the annexation of Barotseland by Zambia in 1969, educational and health facilities in the territory have progressively deteriorated. The advent of COVID-19 pandemic has exposed serious inadequacies in the health sector in Barotseland, as is the case with all marginalized and indigenous people. The mandate to tackle the disease is the responsibility of our occupying state, Zambia, the oppressive regime. However, Zambia would rather that the COVID-19 pandemic was more rampant in Barotseland than anywhere else. This is evidenced by the spate of state-induced local government elections in Barotseland, only when elections and public gatherings have been banned in the country. And Barotse National Freedom Alliance, in fact, we were the first to basically send out the message that no public engagement. Indeed, the fate of Barotse people has been left to divine intervention, as elaborated below. There is no institutional framework in the territory to coordinate COVID-19 preparedness, surveillance, and response efforts at any technical level. There is no laboratory testing capacity for COVID-19 in Barotseland. The samples for suspected COVID-19 patients are sent to Lusaka, 600 miles away, for analysis. There is no surveillance taking place at points of entry into the territory and in healthcare facilities. Travelers coming into our territory are not screened. Truck drivers from Namibia, Botswana, South Africa, Zimbabwe, Angola pass through the borders into the territory freely. There are no isolation facilities to safely manage positive cases and limit the spread of the disease in Barotseland. Suspected cases, mostly healthcare workers, are confined to their homes where they freely mingle with their families and members and visitors. Infection prevention and control measures are non-existent. Some business premises provide disinfectants and insist on the use of personal protective equipment, including gloves, face masks, aprons, hand hygiene supplies, mainly to safeguard their staff from infection. Community engagement through radio, TV, social media platforms, and the distribution of information from the information, education, and communication sector is totally lacking. There is no adequate medical care facilities for COVID-19 patients in the territory, and individuals suspected of having COVID-19 in Barotseland are abandoned by healthcare workers, while hospitals are mined by unsupervised trainee doctors. This makes Barotseland one of the most vulnerable territories to the COVID-19 infections in Southern Africa. I just wanted to piggyback off of some things. I don't know whether I have time just to ask some questions, but I want to ask the UNPO membership at this point that I think in many proverbs from around the world, sort of when you that a leopard does not change its spots. This is a particularly African proverb. That I feel that this is an opportunity for me to say that to the UNPO membership that this opportunity of the General Assembly should be our opportunity to become more confident and more convinced that we will get the support that we need from the outside world at this historical moment, especially after George Floyd's demise, and the fact that COVID is impacting us as unrepresented people. I think we should take the step forward of making sure that we leave this General Assembly completely aware of the fact that the power is actually in our hands right now, to be able to not just motivate our own constituents within our own countries and territories, but to motivate the whole world with a counter narrative. And the counter narratives that have been coming out of from all of the members that have been able to speak. The counter narrative being that this is the time now to turn the tables, because it's not going to change, is my personal perspective. in terms of us being unrepresented and marginalized. But I think now is the time for us to come together and basically convince the rest of the world who feel the same way that they need representation and they need to join us at UNPO. So I just thank you for this time, and I look forward to a conversation about the African Union, compromise spaces, as well as being on the panel for resolutions. Thank you, and God bless everybody. Thanks.
Thank you so much for such a brilliant intervention. Thank you. We will get back to that tomorrow, and during the committees. Thank you again. Let's move on. We have Binota. Here, 1 second. Let's see. Binota Damai.
Yes. Hello.
Yes, Binota. Can you hear us?
Yeah. Yeah, I hear you. Do you hear me?
I can. We do not see you though, but
well, I turned off the camera. Okay, let me check.
But we can hear you pretty well. So worst case scenario, just go ahead with the audio.
Okay. Let me see.
Yeah, we got you.
Okay. All right. Okay. Thank you so much, Fando, and UNPO President Nasser, General Secretary Ralph, and distinguished panelists, colleagues and comrades. Good evening, good afternoon, good morning, wherever you are now. So let me congratulate first to all the new members of the UNPO. So on behalf of the Chittagong Hill Tracks, I would like to thank you, the leadership of the UNPO, and the report of the General Secretary, as well as the report on the COVID-19 pandemic. So let me share one very quickly in relation to the COVID-19. It's the land grabbing issue, whereas our grave concern is also the highest population of the internally displaced persons who has not been given back their land according to the Chittagong Hill Tracks Accord signed in 1997. And during this COVID-19 pandemic, they have suffered from the food shortage and health facilities. And the situation, taking the opportunity of this COVID-19, the political situation and Jumbo political leaders are really a very vulnerable situation. I quote the report of the Human Rights Watch, published on June 3rd. It's a quote, start over 20 years after the peace agreement, the Chittagong Hill Tracks region remains under military occupation, and indigenous people's rights activists face threats of arrest, enforced disappearance, and violence. So there's the report. And despite the political and peaceful solution, the problem of the Chittagong Hill Tracks, the present Awami government led by Sheikh Hasina has intensified its efforts to solve the problems now through repression like the previous dictators' regimes. So as a result, most of the PCJS's leaders and our political leaders now are under the threat, and they are hiding different places to avoid military raid, arrest, and detention. So what I like to say in general, that the overall situation of the Chittagong Hill Tracks region at present, taking the opportunity of the COVID-19 pandemic, has become much more unstable than the pre-accord status of the Chittagong Hill Tracks region. The process of implementation of the accord has been completely stopped now. The problem has become more complex and complicated situation despite the desire of political and peaceful solution, the armed conflict over the past 22 years. The main signatory party of the peace accord, the government, has taken more aggressive roles in resolving the CHT problem, instead implementing the accord provisions, which is a political solution to establish peace in the CHT region. So I conclude by saying that the military, civil society, bureaucracy, political parties, and media must realize that stable and durable peace can be achieved through guarantee of the rights of the Jumbo indigenous peoples, as implementing peace agreement and promotion of respect for human rights are very interrelated. Without one, the other cannot be imagined. Denial of rights will ultimately be opposed, and such opposition often begins as a non-violent protest, but in the face of denial and violent repression, many become armed struggle. So let me end by sharing with an updated information from my place. While I am sitting here, I just received an information that my father has kidnapped by the miscreants. I end up in the village. So there's the latest information. So you can imagine the situation, how it is there. I thank you all and everyone. Stay safe.
Thank you very much, Vinota. Thank you for sharing the hardship of the Juma people, the Chittagong Hill tracks. We have two more short interventions before we go back to the panelists for final remarks and to the President Nasser Boladai to wrap up. Our next intervention is from Shah Jahan. Do I have Shah Jahan online? Let me give you the floor.
Can you hear me?
Yes, we can. We don't see you, but we can hear you. Chab, we can hear you. So
Hi.
maybe go without your camera because we can hear you very well. So just go ahead.
Okay. Thank you very much, Fernando. It's nice to see you after long, I think.
Yeah, that's
And
true.
first of all, I would like to thank you, the UNPO, for giving us this opportunity to speak on behalf of people of Balochistan and represent World Baloch Organization. My name is Shah Jahan Baloch. And first of all, again, because it's Eid, so Eid Mubarak to all who are celebrating it. And to share with you, it's one of the greatest Eid for me to celebrate it with my UNPO family. So greetings to all of you after this stressing period of COVID-19. We are more focusedly discussing on COVID-19, but before that, I would highly appreciate UNPO studies on compromised spaces and the deliberations of General Secretary on post-colonial context. I highly appreciate this research. I think that would be very helpful for the oppressed nations like Baloch and Balochistan. Regarding COVID-19, Mr. President and distinguished panelists, Balochistan has a border with Iran, and there is high number of pilgrims. They go to Iran, and when this pandemic, came, so thousands of pilgrims were coming to Pakistan via border, which is we call it Taftan. So they were placed there, and there was a Taftan quarantine center. And that was mismanaged by the federal government and Ministry of Interior of Pakistan. And from this mismanagement, the coronavirus spread into Balochistan widely and Sindh. Because what was the reason? And it is a claim that 90% of virus in Pakistan has been spread due to this mismanagement of Taftan quarantine center in Balochistan. Why this happened, despite the warnings from nationalist parties in National Assembly and Provincial Assembly, they ignored all the demands to manage this quarantine center of Taftan. And one of the reasons is in Pakistan, this humanitarian assistance is managed by the NDMA, the National Disaster Management Authority. And there are provincial disaster management authorities, PDMA. And NDMA is led by a lieutenant general. And it's a militarized organization, even it's a humanitarian organization, but led by the military regime. So despite this, the PDMA, Provincial Disaster Management Authority, was unable to respond it properly. When it spread it, even in Balochistan, doctors were protesting for PPEs. They were tortured, targeted, and arrested. Can you believe in this pandemic, doctors were protesting for PPEs, and instead of getting that, they were beaten, they were arrested, and they were sent behind the bars instead of having PPEs. And we lost so many brilliant doctors due to COVID-19 situation. And as it has effects, it reflects the political governance of Pakistan, where a province like Balochistan has not empowered enough to take care of their people and take protective measures to protect their citizens and Baloch nation. It reflects clearly the disempowerment of provincial governments because they're dependent on federal decisions and they don't care about Balochistan. They don't care about Baloch lives because Baloch lives doesn't matter for them. And it has affected, interestingly, Pakistan was sending PPEs to USA, but they have now sent PPEs to Balochistan. So you can imagine the kind of neglect they have, the kind of negligence they have, and the kind of isolation Balochistan is in. When it comes to the health, when it comes to the education, because this COVID-19 has implication on health and education in Balochistan a lot. In Balochistan, particularly on health and hygiene, government has some SOPs for the schools. So, but in actual situation is Balochistan that the public schools, 9,247 have no facility of drinking water, and 9,338 schools have no water and sanitation facilities. You can imagine the kind of so-called COVID-19 SOPs in context of Balochistan. When it comes to the education, normally the education institutions, primary, secondary level were closed. But there is a higher education commission. Again, provinces are not empowered enough, even after 18th Amendment in Pakistan, to manage their higher education. And higher education decided to continue online classes, ignoring the fact that Balochistan has 12.8 broadband coverage. And they started trainings for lecturers and professors. And one of the lecturer and professor, even though was close relative of our family, he lost his life while he was training the professors for online classes. And there is no serious response from the government so far. So this is the education part. And alarming situation is that the government of Pakistan escalated the military operation against Baloch nation. Even after this, there was no ceasefire, there was no kind of a peace, there was no, action, at least in this COVID-19 situation, but Baloch people were tortured, killed, illegally detained, and extrajudicially they were killed. And they are reported widely now in media. And one of our great journalists, even he escaped from Balochistan. He was in Sweden, Sajid Baloch, he was killed in Sweden. And I strongly denounce his murder. I strongly denounce this attitude towards Baloch activists, intellectuals, and writers because they are not safe, even getting refuge in countries of Europe. And I think UNPO and our partners should raise voice in EU forums to protect journalists and activists and investigate this case independently because it is a threat to our freedom of expression, a threat to Baloch nation, a threat to all refugees living in Europe and other countries.
Thank you very much. Sorry.
And finally, I know there is a very limited time, but finally say that due to time consideration, because this COVID-19 has made Baloch nation more vulnerable, this COVID-19 has made escalated military operations, has created, due to military operations, a lot of people are forced to migrate from their villages to the towns and cities. And the situation is getting worse, and there is no media reporting, and there is no access to independent reporting in Balochistan. As you may know that in the last 10 to 12 years, our 22 journalists were killed and tortured just reporting human rights violations and reporting incidents against Baloch nation. Finally, I would like to thank you and wish you all the best for the next programs. And I really appreciate the reforms and the strategies of UNPO supporting oppressed nations and people. I think the power of solidarity, we can achieve a lot, and we can, we are more stronger together. And I do welcome, a warm welcome to our new members, and I wish them all the best. And I really appreciate our distinguished panelists and sharing of their experiences, lessons, and their responses and how they are working. So it's a very good learning lesson for our nation and our people of Balochistan, Sabzbat, and wish you all the best. Thank you, Fernando.
Thank you very much, Jehan, for the kind words about UNPO. We have literally 14 minutes to close this whole session. So we have one more question from Charles and one short intervention from Sahir, and then immediately back to the speakers for final considerations and wrap up. We have to do this in 13 minutes now. So Charles, can you hear and see us? Charles? You should be on the screen. Charles? We don't see you. I'll try to move to Sahir, and then we try to get Charles next. Sahir, can you hear us?
Yes, I could.
Yes.
Can you hear? Okay,
yes,
thank you very much. I won't take much of your time. First of all, I really appreciate that you guys are arranging and making it more an effective organization. So I really appreciate Fernando and Ralph. I met you guys. I'm from California. From last 4 hours, I've been diligently listening to all the speakers. It's been really educating event. And I represent World Sindhi Congress, which represents the Sindhi nation, which is the southeastern province of Pakistan. Our homeland, Sindh, became part of Pakistan when Britishers left. But before that, it was an independent country. The situation, as my sister nation from Balochistan, Mr. Shahjahan Baloch already described, how Pakistan is taking advantage of this COVID situation to suppress and create more oppression to the people, the oppressed people in Pakistan, especially Sindhi people and Baloch people as well. And the situation, what Mr. Baloch defined, is not any better in Sindh. In fact, as in our Sindhi saying, we say that fleas attack more the weak cattle. So because we are weak people, because we are in minority, and because we don't have a power, we end up getting a longer stick in this epidemic. And listening to other stories from all over the world of underrepresented people and nations, I see the template of oppression is similar. To take advantage of this situation, to increase the power and the grip over the Sindhi, over the underrepresented people. So the situation in Sindh is pretty bad. In last 4-5 months, obviously we have also more number of deaths and highest number of incidents in Sindh. And then there was a little bit effort from the local government tried to remedy the situation, but the federal government intervention even made it worse. And again, as I said, that there was ulterior motives to do so. In this COVID-19, they kept lots of clandestine plans, such as they recently got a loan from Asian Bank to develop a dam on the northern riparian of Sindh, which is going to ecologically disaster for the southern areas such as Sindh. And then also the issue of missing persons, which in last 4 months, they have done at least 75 people have been missing from Sindh. in the context of so-called they take them and just they disappear. And so I just wanted to again say that it is a sad state of affairs, and I do look forward to having some sort of a conclusive discussion, as Alex mentioned in Q&A session, that we maybe, UNPO maybe come up with a good suggestion and good strategies which we can all use. So once again, thank you, and I welcome the 5 new nations coming and joining our tribe, and I welcome all of you, and thank you, Raul and Fernando, and all the speakers too. Thank you, Nasser, too.
Thank you very much, Zahir, for the kind words. I will do one more attempt to get Charles on the line. If it doesn't work, I'll just... Charles, can you hear us? It doesn't seem that we get him, unfortunately. Okay, so I will just, thank you so much, Dr. Velásquez Nimatuj and Dr. Ismail for sticking with us. There is a member from Khmer Krom has asked a question. I'll just read it out loud, so then if you want to react to that or to any other point that we have discussed in the discussion here, you're welcome. He asked, how can indigenous peoples and other marginalized peoples around the world get organized and prepare themselves for future pandemic or crisis without governmental help? Is there a way to have access to vaccines, future vaccines, not necessarily being member of the WHO, like following the steps of Taiwan? This is his question from Alex Touch, the Khmer Krom member from UNPO. I give back the floor to the speakers that we still have with us. I really thank you for staying. We're almost 3 hours in this call, so thank you very much. Perhaps Dr. Edna, would you like to say a few words to conclude? Hold on, sorry, we cannot hear you. Give me a second. I will unmute you. There you go.
Thank you very much. And it's such a wonderful occasion to have seen and heard the common problems that we all face because we all represent people who have been so deliberately disadvantaged and ignored and very often just discarded, not important. I think what I would like to take back from this conference, which, by the way, I am so honored and I'm so happy to have participated in, and I'm so happy to meet the UNPO. Heard so many wonderful things about you, but we never had to meet. We never could meet. What we can take from this message, from this meeting today, is that there is a whole lot of work for us to do, and there's a need for a lot of cooperation and collaboration between us. If nobody else has any sympathy for us, we should have sympathy for each other, because your cause is my cause and my cause is your cause. Just human rights is everybody's cause. In Somaliland, if I go back to Somaliland, for several months we had no testing capacity. Tests were sent individual, a few tests were sent to a third country. By the time the results came back, the patient was either dead or had recovered, fortunately. Teaching and preparedness for emergency is what we're taking away from this COVID pandemic. Trying to train our people to be able to cope with unforeseen emergencies, could be natural, droughts, floods, whatever. We're so prone to floods and droughts. This is what we have taken from. We're putting a lot of attention to training our health workers to have an emergency preparedness as best possible, and putting things aside in the event that coronavirus comes back with a vengeance. The disparities are so similar, so similar. And all I want to say is thank you also very much for this opportunity to bring the voice from the 4 million people of Somaliland who have not been seen, who have not been heard for almost 40 years. thank you all so very much. And good luck to all of us.
That's true.
Thank you.
That's true. Thank you so much. Thank you very much, Dr. Ismail. Dr. Irma Velásquez, do you have any final remark? Would you like to say a few words? I know this was the first interaction you ever had with UNPO. This is all new to you, I understand, but nevertheless, I believe this is a cause that you're interested in because it's your cause as well, of the indigenous peoples. So if you have any final word, the floor is yours. Oh, you're unmuted, sorry. Let me unmute you. 1 second. Where are you? I think you have to unmute yourself. Yes, there you go.
Okay.
Yes.
Did you hear me? Okay. Okay. Yeah. Okay. Thank you so much for this invitation. I learned I learned many things. There is a lot of information for me, and we share the same problems in Africa, in America, in South America. So I agree with Dr. Edna. We need to work together in order to fight against this system. My final word is about the topic that I said before. For the indigenous people, the crisis brought by COVID-19 is only one more crisis that they are facing with responsibility and with what they have within their communities. But something that the world is living now is that the state in this historical moment are deeply elitist, corrupt, racist, patriarchal, political systems. Sold to us as a democratic, but the crisis of democracy never ends because the democratic system was created to twist our lives and keep us alienated and as far away as possible from resistance. In the end, the small but powerful political and economic elites of the world know that a person's life is very short. So the challenge is to stay distracted, controlled, and divided during those years, because disease, addictions, or hopelessness will take care of the rest. So we need to keep this in mind if we want another world, if we want to be free and we want dreams for and land for our sons and children and daughters. So thank you so much from the bottom of my heart for this invitation.
Oh, I thank you. We thank you. Thank you so much. Really appreciate it. And you can be sure that I'll follow up with you, Dr. Velásquez. We have a lot to work on. So we have to close this panel, but I see that Charles is finally back. Nasser, you will close this, but shall we give a very Charles? Can you hear us?
Yes, yes.
You've been
nice.
trying.
Can even close it if he wants to.
You deserve. Hold on. Let's see. Charles, can you try to unmute you? Because here I have you. One second.
He's muted.
Charles, can you try to speak? Oh, that's frustrating. I see you. Oh, yeah, try now. I'm sorry, Charles, we cannot hear you well. Perhaps tomorrow during the African Union Committee, we can hear from you and relate to the group. I apologize, we really cannot hear you, Charles. I'm sorry. Nasser, maybe over to you.
Yes, but he's still speaking. So, well, I think that was. Thank you very much. Thank you everybody for staying. And to know that, yeah, is it going to speak? No, it seems that.
I will try to write him separately. We really cannot hear you.
Okay.
So please, Nasser.
Well, thank you very much. Thank you, everybody. And that was the distinguished panelists. Everybody spoke very well on the situation, and they were complete with each other. And, well, of course, I have to particularly thank Irma and Edna for staying all the way. But the thing is that we saw that if you are marginalized, it doesn't matter where you live. In the richest country, most developed country, or marginalized in South America or Africa or Asia, it is the same thing. Or even here in Sweden, we have seen too, because there's mostly the people that are, as they say, migrant here or have been affected by the coronavirus population-wise. And that's the problem. So we have to see that we have to be much more powerful. We have to empower each other. And we have seen that before in the UNPO. The thing is that we have to stick together. We have to create a narrative that this world as it is, post-colonial world, is not going to work as it is. You cannot create a country, I think it was Dr. El-Bayoumi, I hope I'm saying her name right, that you cannot create a country in greed, and not create a country in violence, and to not create a country based on this kind of that marginalization, giving amongst the majority just to a minority the power. I mean, in the US we know that the whites maybe have the power, but it's minority among them, and everywhere it's like that. And they use this kind of race distinction, religious distinction, class distinction, just to empower themselves. And that's, I think, this is the narrative we have to use. We have to work together very hard. We have to create a new narrative for the world. This post-colonial world doesn't work for the people like us. I mean, I can speak from our experience as a Baloch. We have been seeing the Portuguese imperialism, and we've seen the British imperialism. But in fact, the imperialism that we are facing in the countries that we are now divided, Iran, Pakistan, and Afghanistan, is worse than that, because they are taking away everything from us. And it's much more, I mean, there has been maybe worse imperialism for the British, for other communities, some other places. But I don't think the post-colonial kind of internal imperialism or internal fascism is helping anybody, be it in the Washington, D.C., or be it somewhere in Somaliland, or in Bolivia, or Paraguay, or in Brazil, anywhere. So we all have a common cause, and we have to stick together. We have to work together. And even if we achieve, I mean, I have to say here, I was very pleased to see Mr. Abdi, my good friend. But I wished I wouldn't have seen him here as a participant, as a UNPO member. I would have liked to have him as a supporting member since he went back. And so we wish him, we want to be less, not more in the UNPO. Of course, we want more support, even if we are less. Even those countries that get their rights, they would be supporting member of the UNPO until there is no cause to fight for. There is no marginalized people, be it indigenous, national minority, or a class separation, or racial separation, anything, or environmental damage that we are all facing as marginalized people. I thank you, everybody, and so hopefully we continue our work tomorrow. We don't have much time. I'm sure Fernando wants to have the closing words. Thank you very much.
No, you did. Just to reinforce, thank you so much. It's been a long conference. This was supposed to take 2 hours. We reached the 3rd hour now, which means that the discussion was very fruitful. It's frustrating because we have lots of members and they all want to speak, but that's why we have the day 2 and 3 this weekend, to go deeper into the discussions and to learn from each other. So once again, Dr. Edna, Dr. Velásquez, thank you so much. To the other panelists who are not here anymore, but they did a brilliant job. This was by far the best panel I've seen at UNPO, and I've been here for almost 6 years. So I'm delighted. It was a pleasure. See you all tomorrow, and have a nice morning, afternoon, evening, wherever you are.
Thank you very much.
Bye-bye.
Good day to those who are going to celebrate day continuously.